Let me pose a question that might make you uncomfortable. If your physician sat you down today and said, looking at your genetics and biology, here's the most probable way your system will start breaking down after 60, would you actually want to hear it? Most people instinctively say yes. Then they spend the following 10 years actively avoiding the precise knowledge that could change the outcome. Here's what strikes me after nearly 2 decades in preventive cardiology and geriatric medicine. There's one piece of biological information that every single person in this nation has possessed since the day they were born. It's printed on a medical card buried in some file cabinet or documented on paperwork from decades ago. And it remains one of the most profoundly underutilized predictive markers we have for forecasting age-related disease trajectories. I'm talking about your blood type. Not in the oversimplified way fad diet books exploit it, not in the superficial way social media wellness personalities discuss it, but in the way rigorous, peer-reviewed epidemiological studies tracking hundreds of thousands of individuals across multiple decades have increasingly revealed that your blood group creates a distinct biological signature affecting how your heart and vessels deteriorate over time, how your cognitive function holds up under chronic stress, how your immune apparatus responds when challenged, and yes, statistically, what condition is most likely to compromise your longevity if you fail to address it proactively. I'm Dr. James Whitemore, and today we're dissecting every major blood type, O, A, B, and AB. For each classification, I'm going to reveal something the vast majority of physicians never discuss during standard office visits. Not because they're deliberately withholding information, but because a 12-minute appointment simply doesn't allow the time to properly connect these dots for patients. I'll connect them for you right now. But stay through the entire video because there's a biological modifier sitting on top of every blood type classification, something beyond the letter designation that significantly alters your individual risk landscape. Most people have never considered it even once. Before we dive deeper, do something for me. Leave a comment below telling me your blood type, O, A, B, or AB. I'll be walking through each one specifically, and knowing yours will make everything that follows dramatically more applicable to your situation. Type O. We're starting with type O, and I want to frame this entirely differently than you've probably encountered before. Type O is Earth's dominant blood classification. Approximately 45% of the global population carries it. Throughout most of human evolutionary history, that was almost certainly a tremendous survival edge. Type O blood seems to have originated in our earliest ancestral groups, forged by environments demanding exceptional physical stamina, vigorous immune defenses against parasitic threats, and digestive systems capable of metabolizing substantial animal protein under survival pressure. Here's how that ancient evolutionary template manifests inside a contemporary body past 60. Cardiovascularly speaking, type O carriers tend to maintain lower baseline concentrations of von Willebrand factor, a clotting protein. Reduced clotting activity means smoother circulatory flow, diminished platelet clumping, and statistically lower probability of the arterial obstructions triggering myocardial infarctions and ischemic cerebrovascular events. Multiple expansive population studies have verified that type O individuals demonstrate meaningfully reduced coronary artery disease risk compared to types A, B, and AB collectively. That's genuinely excellent news. But here's what nobody explains to type O men and women past 50. That cardiovascular protection can morph into a dangerous form of complacency. I've witnessed this behavioral pattern countless times. A type O patient in their late 50s arrives for evaluation. Blood pressure readings are acceptable. Lipid panels are manageable. No significant family cardiac history. And because they perceive themselves as structurally insulated, they begin neglecting the biological systems quietly degrading elsewhere. They rationalize persistent exhaustion. They wave off gastrointestinal disturbances. They power through chronic joint inflammation. Because type O's most dangerous age-related vulnerabilities don't originate from cardiac tissue. They emerge from the digestive tract. The gastric mucosa of type O individuals expresses cellular receptors that Helicobacter pylori bacteria attach to with considerably greater efficiency than in any other blood classification. H. pylori doesn't announce its presence dramatically. It doesn't generate severe acute pain in most carriers. It colonizes silently, establishes residence in the stomach lining, and across years and decades systematically erodes the protective mucosal barrier. Left undiagnosed, this progression escalates from chronic gastritis to duodenal ulceration to, in a substantial percentage of cases, gastric adenocarcinoma. And gastric malignancy detected in advanced stages carries extremely poor treatment outcomes. There's an additional concern. Type O individuals demonstrate measurably elevated risk for certain peptic ulcer complications requiring emergency surgical intervention compared to other blood classifications. This is documented in medical literature. It's not theoretical speculation. So if you're type O, past 55, and you've never undergone H. pylori screening, that conversation with your physician is the single most critical preventive step you'll take this year. It's a straightforward stool antigen test or urea breath test. It's inexpensive, and for type O individuals specifically, it's not routine precaution. It's precision prevention tailored to your exact biological vulnerability. Here's your type O longevity framework. Your gastrointestinal tract represents your primary weakness point. Defend it actively and systematically. That means minimizing chronic use of non-steroidal anti-inflammatory medications like ibuprofen and naproxen unless medically essential. These pharmaceuticals damage gastric mucosa in everyone. In type O carriers, they assault tissue already functioning at elevated biological risk. Incorporate cultured and fermented foods into your regular dietary rotation. Kefir, tempeh, sauerkraut, traditionally fermented vegetables. For type O, these aren't fashionable wellness supplements. They're practical interventions for sustaining a gastric microenvironment more resistant to pathogenic bacterial establishment. And physically, your physiology was engineered for consistent movement. Type O blood correlates with elevated baseline catecholamine activity, meaning your autonomic nervous system operates on higher dopamine and norepinephrine concentrations than other classifications. When that energetic drive lacks physical expression, it transforms into agitation, fragmented sleep architecture, and eventually chronic cortisol dysregulation. 30 minutes of daily aerobic walking, combined with 2 weekly resistance training sessions, will accomplish more for your metabolic longevity than any nutritional supplement regimen. Type O, cardiovascular resilience is your genetic inheritance. Your stomach is your personal responsibility. Don't allow the former to breed negligence regarding the latter. Before we continue, tell me your name and location in the comments. I personally read every response, and I genuinely like to know who I'm serving with this information. Type A. Lean in closely here, because this is the blood classification where the chasm between public knowledge and clinical reality is widest. Type A emerged as human populations transitioned toward agrarian lifestyles, denser communal settlements, increasingly complex social structures, exposure to broader infectious pathogen diversity. The immune architecture adapted accordingly. Type A individuals generate aggressive and highly effective immunological responses, particularly against viral pathogens. In younger decades, that's a legitimate biological advantage. But this is where the blood type narrative becomes nuanced, because what protects you throughout your 30s and 40s begins operating against you in fundamentally different ways by your 60s. Type A blood demonstrates elevated coagulation activity. The platelets aggregate more readily. The clotting cascade proteins circulate at higher concentrations. The landmark Framingham cohort study, tracking over 90,000 participants across 2 decades, revealed that type A carriers face approximately 5% elevated coronary heart disease risk compared to type O. That percentage seems modest in isolation, but here's what makes it clinically consequential for type A specifically. When you superimpose chronically elevated stress hormone patterns onto that baseline hypercoagulable state, the compounding biological effect across decades transforms a 5% statistical variance into tangible cardiovascular events. The risk isn't merely numerical, it's in what your neuroendocrine stress response does to that number every single day. Now, here's the dimension most discussions completely omit. The reason that risk amplification is so significant isn't purely mechanical, it's hormonal. Type A individuals maintain the highest resting cortisol concentrations of any blood classification. Cortisol is your primary glucocorticoid stress hormone, and in acute bursts, it serves valuable functions. It enhances cognitive focus, mobilizes glucose reserves, primes the organism to manage immediate threats. But when cortisol remains chronically elevated week after week, month after month, it executes something extraordinarily specific to your vascular integrity. It inflames and rigidifies the endothelium, the delicate cellular monolayer lining your arterial walls. And here's the pathophysiological mechanism that should concern every type A individual watching this. When your endothelium exists in a state of chronic inflammation and reduced elasticity, it transforms into a surface where hyperreactive platelets preferentially adhere and aggregate. The genetically elevated coagulation tendency of type A blood and the chronic cortisol mediated endothelial inflammation characteristic of type A physiology aren't independent risk variables. They constitute a self amplifying cycle. Each component magnifies the danger of the other. What this translates to practically is that for type A carriers, stress regulation isn't a lifestyle preference or wellness luxury. It's direct cardiovascular therapeutics. It belongs in precisely the same clinical category as antihypertensive pharmacotherapy and statin management because physiologically it's addressing identical underlying pathways. If you're type A and past 55, monitoring your blood pressure every 4 to 6 months rather than annually isn't excessive caution. It's appropriate clinical surveillance calibrated to your specific biology. Request that your physician include homocysteine measurement in your next comprehensive metabolic panel. Homocysteine is an amino acid metabolite that, when chronically elevated, directly damages arterial endothelium. Type A individuals statistically trend toward higher homocysteine concentrations, and the therapeutic intervention is remarkably straightforward. Adequate intake of folate, methylcobalamin, and pyridoxine, found abundantly in dark leafy greens, pasture-raised eggs, legumes, and quality animal proteins. This isn't costly or complicated, but it's targeted specifically to your biological profile. And construct a daily cortisol reset ritual. Not an occasional weekend meditation retreat, not sporadic relaxation when you remember. Something you execute every single morning before daily stresses accumulate. Controlled diaphragmatic breathing, 4-second inhalation, followed by 6-second exhalation, practice for 10 minutes consistently produces measurable cortisol regulation effects in published clinical trials. The consistency matters exponentially more than duration. 5 minutes every morning without exception outperforms an hour on Sunday by a substantial physiological margin. Type A. Formidable immune resilience coupled with elevated cardiovascular risk driven by a stress hormone your blood classification maintains chronically elevated. Managing that hormone represents the most consequential health decision you'll execute this decade. If you're still engaged and finding value here, take a second to type A in the comments. It helps me understand you're watching and benefiting from this content. Type B. The blood classification conventional medicine understands least comprehensively, and mainstream wellness culture handles most reductively. Type B emerged among nomadic populations migrating across the vast interior regions of Central Asia and the Himalayan plateau. These were communities constantly adapting to novel food environments, shifting climatic conditions, evolving infectious disease pressures. The immune system that developed demonstrates genuinely remarkable metabolic plasticity. Type B individuals can efficiently process diverse arrays of proteins, lipids, and carbohydrates without the inflammatory responses other blood types occasionally generate when confronting dietary variation. That adaptability is physiologically real. In the evolutionary context of our development, it represented a profound survival advantage. But here's the clinical complication most type B individuals past 55 are managing without awareness. Type B demonstrates a distinct, not yet comprehensively mapped immune signaling architecture. What research consistently reveals is that type B carriers appear to possess a broadly adaptive immune response, processing varied dietary and environmental inputs differently than other classifications. Studies verify that type B individuals exhibit measurably different gut microbiome compositions, and certain inflammatory dietary triggers, refined industrial seed oils, ultra processed food products, high fructose corn syrup, appear to generate more robust systemic inflammatory cascades in type B compared to other blood groups. The autoimmune disease landscape across blood classifications remains actively studied, and findings are complex. What's clinically clear is maintaining your baseline inflammatory status through strategic nutrition, consistent movement, and regular C reactive protein monitoring represents the most evidence supported protocol for type B longevity. If you're type B and have been managing these kinds of symptoms through lifestyle modifications alone, dismissing them as inevitable aging, it warrants direct physician consultation regarding autoimmune screening panels. Early autoimmune condition detection fundamentally alters treatment trajectory and long-term outcomes. There's a second consideration specific to contemporary existence for type B individuals. The modern industrial food supply effectively represents a calibration challenge for your immune architecture. Refined seed oils, ultra processed foods, high fructose corn syrup, these don't merely constitute nutritionally empty calories. For type B carriers, research indicates these inputs function as particularly potent triggers of chronic low-grade systemic inflammation, the variety that operates subclinically for years, progressively distorting immune precision. Your C reactive protein concentration, a standard inflammatory biomarker available on routine blood chemistry panels, should be monitored minimally once annually. A persistent CRP reading exceeding 1 milligram per liter without obvious acute infectious etiology constitutes a meaningful clinical signal. It indicates your immune system is operating in chronically activated mode, and you need to identify the trigger before it identifies you. Regarding exercise, type B physiology responds optimally to sustained moderate intensity movement rather than repeated high intensity interval protocols. Cycling, swimming, hiking, consistent brisk walking protect your inflammatory baseline substantially better than interval training regimens generating acute inflammatory marker spikes during recovery phases. Type B, the most metabolically adaptable blood classification on the planet. Maintain your immune system precisely calibrated, and it becomes one of your greatest physiological assets. Allow it to operate unchecked, and it transforms into one of your most serious vulnerabilities. Before advancing to the next segment, if this is helping you connect biological dots regarding how your system might be responding to nutrition and lifestyle patterns, do me a favor and tap the like button. It helps this research-grounded practical information reach more individuals quietly managing fatigue, inflammation, or health conditions they can't adequately explain. And tell me in the comments, have you ever received suggestions about possible autoimmune involvement, or has everything been dismissed as normal aging? I read every comment, and I'm genuinely curious how frequently this gets overlooked or misattributed. Type AB. Type AB represents the most recently emerged blood classification in human evolutionary history. It appeared relatively recently when populations carrying type A and type B antigens began interbreeding at scale. And because of that dual genetic inheritance, it demonstrates a genuinely unusual immunological profile. On one dimension, type AB inherited immune tolerance characteristics from both parental types. AB carriers exhibit reduced inflammatory responses to certain environmental antigens, translating into meaningfully decreased risk of specific gastrointestinal malignancies and certain gastric pathologies compared to other classifications. But here's where I need your complete attention, because what type AB gained in immune tolerance capacity, it compensates for with neurological vulnerability that accumulating research has made increasingly impossible to dismiss. Type AB individuals demonstrate statistically elevated risk of cognitive deterioration, including vascular dementia, compared to type O carriers. The mechanism is cerebrovascular. Type AB blood maintains elevated coagulation factor concentrations inherited from its A component, combined with the cardiovascular complexity of the AB antigen profile. Across decades, this generates subtle but cumulative alterations in blood perfusion through the brain's smallest capillaries, the microvascular networks servicing regions most responsible for memory consolidation, processing velocity, and executive functioning capacity. These aren't dramatic vascular occlusions, they're microscopic, gradual changes in perfusion efficiency throughout neural tissue that most individuals wouldn't consciously detect until cumulative effects have been compounding for 15 to 20 years. This explains why, for type AB carriers, cardiovascular health and cognitive health aren't separate clinical conversations, they're identical. Blood pressure management, glycemic control, lipid and triglyceride optimization. Every intervention protecting your arterial integrity simultaneously protects your cognitive longevity. Docosahexaenoic acid, the long chain omega 3 fatty acid concentrated in cold water fatty fish like wild salmon, sardines, and mackerel, incorporates directly into neuronal cell membrane architecture. It maintains membrane fluidity and suppresses the neuroinflammatory signaling, accelerating small vessel cerebrovascular disease. 2 servings of fatty fish weekly or pharmaceutical grade fish oil supplementation discussed with your physician isn't optional nutritional supplementation for type AB individuals. It's targeted neuroprotective intervention calibrated to your specific biological vulnerability. Sleep represents the other non-negotiable variable. During deep, slow-wave sleep phases, your brain's glymphatic system, its internal metabolic waste clearance network, actively flushes accumulated cellular byproducts, including the amyloid beta proteins associated with neurodegenerative pathology. Consistently sleeping under 6 hours substantially impairs this clearance process. For type AB carriers, chronic sleep restriction isn't merely generating fatigue, it's accelerating the precise biological cascade your blood classification already predisposes you toward. 7 to 8 hours nightly. This constitutes your most powerful daily intervention. Type AB, impressive immune tolerance capacity coupled with a brain requiring deliberate, consistent, long-term protection beginning immediately, not at 70. If you're still engaged and this framework is resonating, simply type "helped" in the comments. I genuinely read them, and it helps me understand what's connecting with viewers. The RH factor. Before closing, there's one additional variable almost nobody incorporates into these discussions, and it matters substantially. That positive or negative designation following your blood type letter, Rh positive or Rh negative. Approximately 85% of individuals are Rh positive, meaning they express the Rh antigen on red blood cell surfaces. The remaining 15% are Rh negative. And this distinction isn't cosmetically trivial. Rh negative individuals appear to demonstrate modestly different cytokine signaling profiles, meaning the chemical communication language your immune system employs is calibrated differently. Research continues establishing the complete clinical significance. But emerging data suggests Rh negative carriers may possess heightened sensitivity to certain inflammatory triggers, which means, regardless of your primary blood type letter, if you're Rh negative and managing any chronic inflammatory condition, the anti inflammatory protocols I've outlined today become even more relevant and should be implemented more rigorously. For women who are Rh negative, if you're pregnant or considering pregnancy and your partner or fetus may be Rh positive, this represents a medically critical conversation requiring immediate obstetric consultation. Rh incompatibility during gestation is entirely manageable with appropriate medical intervention. It requires that intervention, and it requires it proactively. Know your complete blood type designation, the letter, and the Rh status. Ensure your physician has both documented in your permanent medical record. Now, here's the most important statement I'll make today, and it's the element most blood type content completely avoids. The statistics are legitimate. The risk elevations are documented in medical literature. The biological mechanisms are genuinely significant, and they are absolutely not your destiny. I've observed type AB patients in their mid 70s demonstrating sharper cognitive performance than colleagues 15 years younger. Not because their genetic risk profile was somehow different, because they comprehended what their biology was working against and constructed their daily existence around systematically addressing it. They slept 8 hours nightly without compromise. They consumed 2 servings of fatty fish weekly without exception. They maintained blood pressure consistently below 120/80, not merely when convenient. They engaged in genuinely challenging cognitive learning, not passive content consumption, but authentic intellectual engagement. Their risk profile remained present. The statistical probabilities still applied to them. They simply chose to confront it directly rather than allowing it to accumulate silently across decades. The gap separating genetic predisposition from actual health outcomes isn't small, it's enormous, and it's occupied entirely by choices executed consistently across years. That gap represents where your agency exists. Your blood type isn't a predetermined sentence, it's a navigational chart, and a chart only provides value if you're willing to study it carefully. Now tell me something. What's your blood type? And does the profile I described today align with what you've actually been experiencing in your own health trajectory over recent years? Share it in the comments. I read every single response, and what emerges consistently in this community directly shapes the topics I address next. If you found this valuable, there's another video linked in the description where I examine the 3 most commonly overlooked root causes of persistent fatigue and resistant hypertension in adults over 55. Conditions that are addressable when identified early and almost invariably mismanaged when they're not. Take exceptional care of yourself. You've carried this body a long time. It deserves understanding exactly how it operates.